Hello.
Hello,
Hey,
how are you?
Good. How are you?
Pretty good.
Good. It's Friday, right?
We made it to the end of the week here.
Another week. Friday of week 5.
I know.
oops.
So if you guys could put your name and your campus in the chat, that'd be fantastic. Okay, I'm just trying to get everybody in. Anybody have any fun plans for the weekend?
Right yonder, yes.
Super Bowl.
Oh, it is Super Bowl, isn't it?
Yep.
Forgot about that. It is Super Bowl.
If
Somebody's-
I don't go to sleep first. I'm
What?
exhausted. But if I don't go to sleep first, because I'm exhausted.
Oh. Okay. So are all of you guys making contact with your teammates for your group project?
Yes.
Is that all in the work? Is that all in the works for everybody?
I sent them an email, but we're all on different schedules, so that's the
Right.
hard.
Right. Right. Okay, well, we made it to week 5. We're at the end of week 5. Next week is midterm week. Hard to believe next week is week 6. I don't know where this term has gone. So with regards to exam 1, I've already met with numerous students. I really appreciate the outreach of you guys wanting to get together to review the exam. I've had there are some students though that scored below the 78 that have not reached out to me that I really would like to hear from and set up a time to review. I mean, I think I've done probably close to 18 reviews in the last week with students from all different classes, both in the RN and PN. So it's really, really great to see students reaching out to wanting to review their exams. I highly encourage, if you got below a 78, to review. And then I've met with several students that actually were some in the 80s and 90s that wanted to review their exam to see which concepts they missed. So I don't ever remember for these first exams in both the RN and PM program having such a large group of students that want to tutor or review. Let's use the word review. I don't want you to think that tutoring is a negative thing, meaning you need help or you're not doing well. Maybe if we phrase it to review the concepts that you missed. How does that sound? Versus tutoring. But that's essentially what it is, reviewing the concepts that you missed. So it's really important to do that, irregardless of what score you got. So for those of you that I have met with and I'm scheduled to meet with, awesome. Really enjoyed all my one-on-one sessions with people, really getting to know people, and it's been great. So there's still an opportunity to review exam 1. If you could if you still want to review, what I'm asking people to do is just give me some times and days and times next week that potentially would work for you. And then I'll work them into my schedule, my teaching schedule, and all these at-risk meetings. Speaking of at-risk meetings, so I'm sure you're aware, but every other week, we have every week. Okay, so Tiona, just send that to me in an email. Okay, I can respond better in an email versus on here. So yeah. So at risk. So if students are at risk means below a 78 for your current KGA, attendance issues, homework issues, that's considered at risk. Okay, so I'm required, all faculty are required to fill out an at-risk report that gets sent to your dean every week. I try and do mine on the weekends, no later than Monday. So I mention this to you because if your deans are reaching out to you, hey, what's going on with homework? Hey, what happened on exam 1? Hey, how come you're not attending class? That's because they have got an at-risk report from me. I'm not tattling on you, but I'm required to fill out these reports. Okay, so don't be surprised if you, I mean, if you're at risk, and so don't be surprised if your dean reaches out to you. Every week we have at-risk meetings with all the campuses. It's on an every other week. So this week I have 6 or 7 at-risk meetings. Next week in the rotation, I have another 7 or 8 meetings. So every other week we're actually meeting in person. The ground instructors, deans, and online. So we meet and discuss students and discuss progress, discuss how we can support you. And it's actually really, really helpful. I enjoy these meetings. So I fill them out as far as I've reached out to the student, they've responded, we're scheduled, we've met. I've reached out to the student, we haven't met yet. I'm waiting to hear back from the student. So we've been doing this all along, but I just wanted to, because I had a couple of emails this week of somebody questioning absences or whatever. And remember, if you're the attendance policy is if you're a minute late or 2 minutes late, you have to get 15 minutes taken off. So that's all been communicated to you. So anyway, so I just wanted to explain the at risk. Anybody have any questions about that? So I don't want it to seem punitive at all. It's actually meant to identify students at risk and to talk about how we can support you better. Make sense? Okay. Anybody have any questions about that? We have exam 2 coming up. Let's see, it would be 2 weeks from today, you would be taking the exam. Do I have that right, Bobby? 2 weeks from today, you'll be taking the exam. Bobby had me a little frightened there. She thought exam 2 was in March. Had me a little frightened. So exam 2 is
discombobulated.
exam 2
is not next Friday.
No,
No,
Oh,
it's the
okay.
24th.
it's the 24th. Yeah, I have to keep that's okay. I am my RN exams are in weeks 3, 6, and 9. My PN exams are weeks 4, 7, and 10. So you'll be in week 7. Okay, so that's 2 weeks from today. All right, so today we're going to cover content from weeks 4 and 5 because last week you were taking an exam. And we'll cover last week and this week, and then next week will be week 6, and then that will be the 3 weeks for the information for the exam or the content for the exam. I sent you a study guide earlier in the week. Has everybody seen that? Or at least has everybody acknowledged that they got it? So my suggestion would be that after today, 2 of the 3 weeks will be covered. So sometime over the next, I don't know, well, the information's still fresh. Sometime over the next 2, 3, 4 days, go through your study guide and highlight the areas we've covered. Make sure you understand what's on the study guide. Okay, because by the end of next week, the whole study guide should be covered. Okay, and remember, the study guide is a compilation. It's a summary. It's a kind of a what am I trying to think of? It's a snapshot of what we've been covering for 3 weeks. Okay, it's a snapshot of the important concepts and the knowledge that supports those concepts. Okay, and remember that you have a lot of this previous knowledge from previous classes. These concepts have been introduced to you. And I keep saying it every week. We are now applying all that information and knowledge from clinicals, from on-ground classes, from sims, from labs. We're now applying it into the community setting, right? We're trying to, our next gen is moving us towards clinical judgment. That's what this is all about now, clinical judgment, taking the knowledge we have and putting it into practice in the community setting. Okay. I know you're sick and tired of me saying that, but as I do my reviews, you know, there's a lot of students that have previous backgrounds in different areas, and sometimes it's hard for them to let go of previous backgrounds and previous experience and not use that into thinking about how to answer a question. So I'm asking you to take off all those other hats. And when we get to community, just think about caring for people in the community. Okay? Does that make sense? So I gather and learn a lot of valuable information by meeting with students. I really do. It's really, I love it. I love it. So, okay. Questions. Everybody's working on their group projects. It's not too late if you haven't already started to get going on this vulnerable populations assignment.
I have a
Okay.
question. Group projects.
Yeah.
I
Who's-
reached out to my group, and 2 other people did message me back, but one person is not responding at all.
Okay.
And I'm gonna do her part, like, but I feel like I already have a lot to do, but it's just very, very frustrating when you have a lot to do on top of everything else, and we have to do other people's part. Like, so
Well,
I don't know.
Why don't you send me an email with the information? I will reach out to the students that is not responding. And we'll go from there. How's that?
Sounds great.
All right. Send me an email. Okay. Questions. Okay. We'll do the quiz at the end. We're going to cover week 4 and week 5. Remember, from week 4, you have your readings from week 4 are in the module, right? There was no book 4 readings or week 4 readings in the book. They're all in the module. Okay. And then for week 5, there was some book reading. Okay. And remember, when you go to the book, you don't need to read the chapter from start to finish. You need to have a look at the objectives, right? Look at the objectives, see what's being expected to you. It says at the top of the objectives, by the end of reviewing this chapter, the students should be able to. right? Articulate, describe, whatever the verb is. But you really use those objectives because that's how we build our study guide. And that's how we build our exams. Okay. So let's talk about last week's special vulnerable populations. Okay. Pregnant adolescents, LGBTQ, mental illness, alcohol, tobacco, and other drugs. What do we, let's see. Just got a lot of papers going on here. I just want to make sure that. Okay, what do we know about what makes pregnant teens so at risk? And this is hopefully you prepared, hopefully you read your readings, but what makes pregnant teens so vulnerable? Why are they considered a very vulnerable population?
Lack
of knowledge.
Lack of knowledge. What else?
I don't think they move by impulse decisions.
Mm-hmm.
There are higher rates of abuse and violence.
Mm-hmm. Yep. Are they focused on the, what's their time focus? Are they focused on the future?
No.
No.
Present
Okay.
oriented.
They're present oriented, right? They can't think ahead to the future. Okay. They're much more likely to be caught up in a cycle of poverty, right?
Yes.
Health challenges to pregnant teens, higher rates of sexually transmitted diseases, right? Higher rates of addiction. I'm kind of going between your notes and some other notes I've taken. So that's where my information is coming from. Okay. So higher incidence of sexually transmitted diseases, higher incidence of drug and alcohol abuse, violence, domestic violence is prevalent with the teen population. Poor nutritional status, right?
Mm-hmm.
Substance abuse, mental health issues, if I already haven't said that. What else do we have going on with pregnant teens?
A lot of them think that they can do anything and they're invincible. Nothing can stop them at doing, can cause some risky behavior.
Mm-hmm. So let's say you're working in a clinic and the pregnant teen shows up and they're say in their second trimester. Okay. What would you do? I mean, what kinds of educational opportunities, resources, teaching can you do with them? What are the most important parts of their pregnancy that you need to focus on with them?
Have they had any medical care?
Yeah,
They
the
had any
prenatal-
medical care?
Also make sure
Nutrition.
they get on prenatal vitamins.
Okay.
And nutrition.
Nutrition is big. What about school?
Oh,
Go ahead, Bobby.
I was gonna say, check whether they're actually attending school
Okay.
and maybe what their home life is.
Mhm.
And if anybody else actually knows that they're pregnant.
Support systems. School is big. One of the most important things we need to make sure with teens is, why do we want to keep them in school?
Where they can get their education.
For higher education, so they can try to avoid poverty.
Exactly. So one of the most important interventions we can do for pregnant teens, believe it or not, is trying to keep them in school. Okay, the higher the education they can achieve, the higher the probability of a better outcome for both them and the baby. Okay. So direct correlation exists between poverty and poor health outcomes. Poor teens are nearly 3 times as likely to drop out of school than their non-pregnant counterparts. Okay, so whenever we have the opportunity to keep these students in school, we should be taking advantage of it. What about postpartum? Let's say you're the community health nurse, and now you're doing a postpartum visit with the teen and the new baby. What is that going to look like? What are you going to focus on?
The way she take care of the baby and nourish the baby.
Is she bonding with the baby?
Depression.
Yeah. Depression? What about observing the way things are going in the house? Right? Are there other people living in the house? How are their relationships? How are they communicating with each other? Is it a functional home? Is it a dysfunctional home? Does she understand growth and development of the baby? Does she understand how to meet the baby's needs? This is what happens in the community. These are the visits you do if you're working in community health with the new families. Are there any signs of abuse? What does the house look like? It's that family assessment, environmental assessment. What resources do you know about in the community that might help? Are there parenting classes that she can attend? Do you need to make a social service referral? If it's an abusive household, which it's a high risk in teen pregnancy that violence and abuse are prevalent, is there a backup plan? Okay, so teen pregnancy is for community health is a big topic. Okay. What about the LGBT population? What do we have to do as nurses to be able to competently and compassionately care for this population?
Don't
What is,
discriminate
pardon me?
against them.
Advice.
Do not discriminate against them.
Be non-judgmental.
Does anybody work with the LGBT community? What are
Okay.
their, go ahead.
Well, I was going to say, when I worked in like the ICU and ophthalmology, I would have people come in that want to be called like by other names. Like if it was really John, but he wants to be called Karen, like you have to call them by what they want to be called by and be unbiased to however they're, they feel towards their life, even if you don't agree with it.
So we as nurses have, this is an example of culturally competent care. We as nurses have the obligation to provide culturally competent care. And this includes the LGBT families. There's the reading in your module on the LGBTQ is please take a moment to read through that. It gives a lot of historical information, a lot of current issues. It's part of your reading, so you need to read it anyway, but I would really encourage you to have a look at that. Okay. There are some nurses that do have some discomfort in caring for this group of clients, this population. We have to evaluate our own attitudes and own beliefs, learn about this culture and be able to competently take care of them. Right? We need to provide a safe environment for them to be able to talk about their sexual orientation. And understanding our own feelings. Okay. Like Bobby said, talk in an open, non-judgmental way. You have to build trust. This is another example of having to build trust with this community before you can start to really have them open up to you. Okay, rather than making assumptions or appearance. Okay, we need to just ask open-ended questions. So, for example, rather than asking a client, are you married or do you have a boyfriend or girlfriend? Maybe consider asking, do you have a partner? Right? Are you in a relationship? Those kinds of questions don't assume, I mean, you can't assume heterosexuality, right? What kinds of questions can you ask this population that doesn't assume heterosexuality? Because certain types of questions, the way they're phrased, can make that assumption. Okay. CDC has recommendations for screening. Does anybody know what those are? Those are in your readings. The annual screenings for the prevention, this group is high risk for, this population is at high risk for sexually transmitted diseases. The CDC has recommendations for annual screening. Do you know what those are? Or you need to know what those are. Okay, there's 4 of them. Okay, HIV screening.
I was gonna say the HIV screening, hepatitis screening,
Mhm.
Syphilis and gonorrhea,
yeah, syphilis and
the
gonorrhea.
chlamydia.
So HIV, syphilis, gonorrhea, and chlamydia. Okay, herpes is not part of that annual screening. Okay, so you do need to be aware of those screenings. Okay. What about mental illness, anxiety, mood disorders? We know that this group, high risk for homelessness, substance abuse, violence. What are some of the major, mood disorders you're going to have to know about? Are we, to understand this concept, general anxiety disorder? What's that? What's general anxiety disorder? There's a couple of them. General anxiety disorder, OCD, paranoia, bipolar. We have to have an understanding of those. Can anybody
What-
tell me what any of those are?
General anxiety disorder is like when you consistently like worry about something like that impacts your own life. Like if you overthink like situations or you might perceive things as being like threatening to you because you decide to, do certain things in your life.
Okay. All right. What about paranoia? What does that look like? Have you guys had mental health yet?
No.
No,
No,
mental
Okay.
health coming in
we
last
haven't
term.
used her.
Okay. All right. I'd like for you to know about paranoia. Or
Paranoia, I
not
was,
paranoia, phobias. I'm sorry, phobias.
Paranoia is like the irrational like suspicion of like something like happening to you that's not really happening.
Okay. What's a phobia?
something
Phobia.
that you're scared of, something that you're scared to do, or something that you're scared of.
Mhm. I'm just simply reviewing the notes of your readings that are in the module. So if you want to follow along, that's where I am. Okay. What about OCD? What's OCD?
When you
Like
have to have something done a certain way,
Mhm.
or you do something so many times, you're not sure for, it's like, for instance, you might think you locked the door and you keep going back and forth to the door, thinking that you locked it to make sure that it is locked.
Okay. And what about PTSD? What's PTSD?
as a traumatic event that happened to you and it's still causing you like stress or discomfort and the inability to function like your everyday life because of something happened.
Okay. Anybody want to add to that?
You see that a lot in veterans.
In what? Yeah,
Veterans.
absolutely.
A lot of time in individuals who like been shot or things like that.
What about if you witness a violent crime or you witness something? You don't necessarily have to be the victim of a violent event. What if you witness something? What about kids who witness things in the home or things in public that are traumatic to them? Bipolar. What do we know about bipolar?
Highs and lows.
Highs and lows, extreme sadness, hopelessness, helplessness, right? And the other extreme is elation, hyperactivity. Okay. Lithium. What do we know about lithium? Lithium is used
For
for bipolar. Okay. If we're working with a patient who's bipolar and they're on lithium, what kinds of things do we want to teach them?
not to double up on doses.
Okay.
And not to stop the medication,
Not to what?
not to stop it abruptly to
Mhm, mhm.
Don't drive. They might have like a hard time sleeping.
What about the effects of sodium from lithium? Hydration.
It could be like dehydrated.
Mhm. Okay. So those are those are a list of the major mood disorders that you're going to see on your study guide. So make sure you take a look at those, but also make sure you do the reading. That's all in there. Okay, substance abuse. Okay, what do we know about alcohol? Alcoholism. What kinds of health effects are from alcoholism?
Dehydration is one. You can get dehydrated from it.
Liver disease.
Liver disease.
This-
Vitamin B deficiencies, folic acid deficiencies, magnesium deficiencies, right? Iron deficiency anemia. Nutrition. What happens with with alcohol abuse with nutrition?
Lack of.
Well, they don't
They
eat.
don't adequately eat. They don't adequately eat.
Right. Right. So think about if you're working with patients that clients that have a history of alcohol, they're alcoholics. What kinds of teaching? What do you teach them?
Stop drinking.
Well, yeah. What about
Drink.
rehabilitation, detoxification?
Yeah.
Do you know the areas in your community where you can refer them to? Get some support. And then what about the liver metabolizing certain kinds of alcohol? So for example, in 1 hour, you can take notes on this, in 1 hour, the liver is able to metabolize 0.25 ounces of whiskey, 4 ounces of wine, and 12 ounces of beer. What affects the blood alcohol concentration? Maybe how much you drink,
How fast you drink, how much you drink.
how much you
How
drink,
long?
how quickly you drink, do you have food in your system?
Yeah. Your
Person's
size.
weight and sex.
Your size.
Yep. Yep.
if you're hydrated.
Mhm. Okay. What about tobacco? let's say we're working with a family that is a smoking home and we want to, the goal is to make it a non-smoking home. What kinds of teaching, what are we going to do with the families? How do we help them move towards a non-smoking home? Let's say they have kids in the house, or even kids with asthma in the house.
Well, if they do smoke, at least smoke outside instead of in the house.
Okay.
And you can offer nicotine patches if they're willing to stop smoking, to try to stop smoking.
Yep.
Educating them on children have a higher rate of respiratory or ear infections or asthma that's in the home.
Mhm.
And it's a higher risk for infants having SIDS.
Yep. Yep. Absolutely. What if the parent says, I switched to vaping or I switched to e-cigarettes? Is that okay?
No,
It's
it's
Why?
still toxic.
worse.
No, because the oil
What about the
is
oil?
harmful to the child if the child get a hold to it.
The oil is actually poisonous.
When the chemicals in it are toxic enough. I mean, they're just as toxic, so it can damage your lungs.
Yep. So be mindful of that. Maybe knowing your resources in the community. There's smoking cessation programs that you can maybe direct them towards, nicotine patches. But if you're working in the community, this is going to be an issue. You will be working with families that you're trying to help educate on the effects of long-term smoking on them, their family members, their kids, and how it creates future health issues for everybody. Okay. What about amphetamines? If you have somebody, a client present to you, then you suspect amphetamine use or abuse, what kinds of physical symptoms might they present with?
A high body temp, high heart rate, high blood pressure.
They might be
Fatigue, mental altered status.
Mhm.
Yes.
Is this an emergency situation?
Yeah.
Yes.
Yeah, yeah, it really is. And so you need to be mindful of what a patient might present with, what kinds of physical symptoms, for you to be able to do your assessment of what's going on. Is this maybe an amphetamine overdose or amphetamine long-term use, abuse? Okay. Okay, let's switch gears here to hospice nursing, hospice and palliative care. Okay, what do you think the role of the hospice nurse is?
Keep them comfortable.
In the last stages.
What are the most important things for our clients that are in end-of-life care?
Pain control, comfortability.
Pain control, quality of life, comfort, right? Alleviate suffering. It can be hard for families. Really, it can be really hard for families. What if the families aren't on board altogether? Wanting the same outcome. What is the hospice nurse? If you've done your reading, the hospice nurse plays that role quite a bit.
Mhm.
Okay.
Offer some type of support or something.
Pardon
They
me?
become not just a nurse. I mean, they're more like an overall psychological.
Mhm.
And a lot of times, if the patient is comfortable with the nurse, the family's going to be comfortable with the nurse. So they're going to be more dependent on them as well.
Right. Yep. But the hospice nurse is really, I mean, obviously she's responsible for the client, but she's also takes care of the family. How do you help educate the family on what's going on? What if you have family members that disapprove or disagree with the way treatment is going? How do you, as a hospice nurse, bring everybody together? Because one of the goals of the hospice nurse is to have everybody involved. What if you have the distant family members that don't want anything to do with it? They seem unengaged or disengaged. How do you bring them to the bedside? And maybe they have their own traumas going on. Maybe they had somebody that's recently passed away in their circle. Grief, the stages of grief. What are the stages of grief?
Denial, anger,
Argument, acceptance,
Okay, start over. Denial,
anger,
anger,
bargaining,
bar-
Bargaining.
acceptance,
that's only 4.
depression.
Yep. So you're going to have family members in all different stages of grief. You need to understand what these 5 stages of grief are, and you need to be able to identify which stage a family member might be in. Okay, so if a family member says something, you have to be able to say, okay, they're in the denial stage of grief. They're in the acceptance stage of grief. Okay, so it's important for you to review the 5 stages of grief. This is part of hospice nursing. Okay. What about the faith community nurse? Does anybody know what a faith community nurse is? What would you think a faith community nurse is?
something like religious nurse or something, dealing with religion. You say faith?
Mhm. So
Yeah.
faith community nurse works in the congregation. Okay, that congregation can be whatever your religion, whatever your setting is, church, mosque, temple, whatever your religion is. Okay, a faith community nurse offers that spiritual aspect to the health plan. Okay, there's a difference between religiosity and spirituality. So religiosity means that you are part of a congregation with a group of people and you practice the same religion. Okay, where spirituality is your individual thinking of what is the higher up all about, right? What is your overall view of spirituality? Okay, you need to know the difference between those two. And if given an example, is it an example of religiosity or spirituality? Okay, so religiosity is focused on the one religion, where spirituality is, what is your worldview? What is your worldview of the higher up? Okay, there's 2 different kinds of models that faith nursing uses. They use a congregational model and an institutional model. And we need to understand the difference between those 2. Does anybody know the difference? Okay, so the difference is the congregational model, the nurse is working directly with the congregation. Okay, whatever the needs and goals, objectives for that congregation, the nurses, she may be doing grief counseling, she may be doing grief support groups, maybe health fairs, maybe visiting new families, new babies. Okay, so she's doing her tasks are within the congregation. So that's your congregational model. The institutional model is when we reach out into the community and try and partner and coordinate services. Okay, so maybe transportation services, maybe urgent care services, food, Meals on Wheels. Okay, partnering with home health agencies to do IV therapy, IV infusions, home health visits for wound care or whatever. Okay, so that's the difference. Congregational, they're doing functions, tasks within the congregation. He or she can't do everything. But if it's a fairly large congregation and they want to provide services other than the minimum amount that she can do as a congregation, then they start partnering with outside agencies, community resources, and it becomes an institutional model. Does that make sense?
Yes.
Okay. Ethics. Why is ethics one of the foundations of our nursing practice? Ethics is big. We make ethical decisions in our life every day. Whether it regards to family, your job, your community. What is ethics? Doing morally the right thing.
Right.
Right?
Yes.
We are facing ethical dilemmas in every part of our life, are we not?
Yeah.
Advocating for your elderly parents, advocating for your kids, advocating for your spouse or your partner, advocating for better health outcomes in your community. Okay, ethics is one of the foundations of our nursing practice. Okay, so do you guys know what an ethical? Have you heard this in your workplace? Ethics committee. What does an ethics committee do?
Is it like keeping everybody on the right track and keeping everybody where they're supposed to, like doing correctly? I know, like ethically, you would want to be able to do something without someone having to look over your shoulder, doing the right thing.
Doing the right thing. So
And-
ethics committees in your facilities or in healthcare are designed to they deal with ethical dilemmas. Let's say you have an end of life case in your hospital or end of life case in your home health, or you have pregnant teens that want to make decisions about whether they want to keep the baby or not keep the baby. Ethical committees nurses participate in. They're not trying to solve the ethical dilemma. They're trying to talk through what's the right thing to do using our ethical principles. There's a couple things you need to know about ethics. We have some ethical principles and we have some ethical theories. Okay. The most common ethical principles we hear about are beneficence and non-malfeasance. Do you guys know what beneficence is? Ethical principle of beneficence.
Do right. Do right.
Do right, do good. In the same circumstance, let's say all of us were in the same clinical setting. What would we do that would be the right thing, common sense, ethically correct? Okay, we try and do as much good as possible. We're non-malfeasance. What's that?
When you do harm, I believe you're doing harm.
Do no harm. Do no harm. There's a difference. Do good and do no harm. So let's say, go ahead. So what would any competent nurse do in the same situation? I'm just reviewing a question with students. I think it was in my RN exam about this. And the question was, I think the example it was giving is you're going to cath a patient and you contaminate the sterile field. What would you do?
Start over.
Start over. Do no harm. Right? That was the example used for defining the what ethical principle. We were talking about non-malfeasance. Do no harm. Okay. Some other issues we deal with in ethics is advocating for our clients. We're always advocating for our clients, right? The best care, making sure they have insurance, making sure they have the support when they go home, right? Respecting their autonomy if they don't want treatment. That's one of our quiz questions today. Okay, what do you do if a patient says, I'm done? I don't want any more treatment. Do we accept that?
Educate them, but you have to accept their, where they're coming from as well,
Mhm.
without crossing the line of trying to force them to do something that they really don't want to do.
Ethical theories that you need to be familiar with, and I'm just going to read them. You guys can go and do your due diligence and investigate what they are, but the ethical theory of principalism. Okay, the ethical theory of utilitarianism. Utilitarianism is it's focused on outcomes. And then the ethical principle of deontology. These are probably foreign words to you if you haven't read or prepared. Yeah, deontology focuses on the righteousness of your actions. So what is the ethical duty of a nurse? Provide high quality, unbiased nursing care to every patient assigned to us. What happens if you have such an ethical dilemma based on your beliefs and your values and your practices that you're unable to care for a certain client? What happens then?
You find another nurse and then
You switch out with someone.
Right? You can't abandon the patient just because you don't agree or you can't take care of them. You can't, there's no such thing as abandonment. You have to find somebody else to take care of that patient for you. Okay. Okay. Oh, let me go back to the hospice. I want to talk about for a minute what's therapeutic communication?
Talking with the client, talking with the patient, and to give them open-ended questions so y'all can develop a rapport.
It's where you ask open-ended questions.
Mhm.
So you can kind of get an idea of where, without just getting yes or no answers.
Okay. Avoid making assumptions. Right? Acknowledging what they're saying. I think we have a couple of quiz questions based on that. Okay. Have a look at your week 5 notes. It discusses everything we've just talked about. Okay. Religiosity versus spirituality. All the information we covered is either in your notes or in your readings. Let's go to the quiz. Let's see how well we do in the quiz. And I have a question for you. After we take the quiz, remind me to ask you. If we had taken the quiz at the beginning of class, how would you have done versus taking it at the end of the class? Because there's a lot of classes that are doing their quizzes at the beginning of class now to check preparation, check the knowledge before class even starts to see where it needs to be focused. I haven't jumped there yet. I'm still liking doing it at the end. But one thing to think about is how would you have done on the quiz if we did it at the beginning and hadn't covered the content yet?
Not as,
Basically, it's,
not as well if we did it at the end.
pardon me?
I don't think I mean, personally, I don't think I would do as well if we did it at the beginning versus at the end.
Well, what if you had done the reading? I'm not saying you didn't, but what if you did? It also determines how well you're preparing for class.
That's true too.
right?
Sometimes you
kinda-
could prepare and still I feel like it's better because I get a better understanding when you explain
Mhm.
what it is that you're looking for than me going in blind. Because even if you do prepare for the quiz, doesn't hit until you explain what's actually going on with the chapters.
Agree.
Okay.
But that's just me.
Does anybody have any questions on the content we covered today? We covered a lot. We covered our very specific vulnerable populations and then some of our roles as a community nurse, hospice nurse, home health nurse. So a lot of information to cover. Let's try our quiz. So everybody pull up quiz 3. Okay, who wants to read the first question? Well, I need somebody to read the first question.
The school nurses engaging in a primary prevention program. Which intervention is appropriate? Provide a list of clients that provide confidential.
So
pregnancy
if you could read the topics out loud or the
Provide-
answers.
provide a list of clinics that provide confidential pregnancy testing. Discuss where and how to obtain ongoing contraception. Educate on the side effects of antibiotics for gonorrhea. Create a pamphlet describing an appropriate prenatal diet.
Hey, so this is primary prevention. What's primary?
Before me,
Prevent is
prevention,
where it happens, like trying to prevent.
Okay,
I would say discuss where and how to obtain ongoing.
Contraceptive, yes, me too.
I agree.
okay, why is A wrong? Why is A not primary?
Because
it's screening.
yes,
Okay, and what's that one?
it's secondary.
Secondary.
Okay, why is C wrong? Or what is C?
Educate on side effects of antibiotics for gonorrhea.
That's
gonna be-
tertiary
That's going to be treatment.
because they've
Why is
already
it-
been diagnosed with the gonorrhea.
Exactly, they already have the condition, right? So
Yes,
that makes it a tertiary intervention. And why is D? What is D?
Already
is-
pregnant.
They
She
already
was
be
pregnant.
tertiary as well. 'Cause she's
Tertiary.
already pregnant.
She's
yeah, they
already
already-
pregnant, right? So do we understand why B is the right answer?
Yeah.
Yes.
Okay. Okay, somebody do question 2.
Which
Which-
counseling is appropriate to provide to a pregnant adolescent? Continue using condoms with every sexual contact to prevent STDs during pregnancy. Maintain the sexual diet without modifications. Prenatal care can be established in the second trimester. Adoption decisions must be made as early as possible.
I would say, go ahead.
I would say A.
Me
Why?
too.
Why would you say A?
Because I mean, and I think that's important, like during pregnancy to prevent STDs.
Well, they're at risk for STDs even while pregnant, correct?
Yeah.
Is that right?
Without being pregnant,
Yeah,
they're at STDs. So yeah, I think that's important.
yeah. So A is the correct answer. Why is B wrong?
Because
It's telling her to
It-
maintain her
modify-
diet regardless of her being pregnant. So you have to change up your diet once you become pregnant because there are certain things that you can and cannot have.
Excellent, excellent. Yep, yep. And then why is C wrong?
Because prenatal health care should be established as soon as possible.
Right, we don't want to be waiting until the second trimester. And then why is D wrong?
Because that doesn't have to be decided right away.
Yep. Does everybody understand that?
Yes.
Yes.
Okay. Question number 3, go. Somebody
Which
read.
intervention should be prioritized for a child who has witnessed a violent crime? A is teach stress reduction techniques to child and parents. B is to assess for family history of post-traumatic stress disorder. C is obtain referral for mental health counseling and services. And D is observe for emotional or behavioral developmental issues.
Okay.
I think it would be D.
Well, what's the important word in the question?
Prioritize.
Prioritize.
Prioritized. Okay. So this could be an example. I'm just going to jump in here. That if you only get to pick one answer in a question, yet you get to the answers and a lot of them look like they could be okay, or they could be right, what should you do?
Eliminate.
Okay, before that, let me just give you the answer. You need to go back to the question and reread the question. You missed something in the question. Okay, and so in this case, if you start reading this and go, oh yeah, that looks right, yeah, we should probably be doing that, but you can only pick one answer. Go back and read the question. You might have missed the word prioritized. Okay, so this is an excellent question. That's an example of that. So if we had to prioritize,
I think the answer would be C.
Yes.
Okay. Do
I
we all
think
agree
that-
with that?
Yes. Because you're looking for the long term of it. So you want to have him to talk to somebody now and continues to talk to somebody to prevent the emotional behavior
Correct.
development issue.
So you have to do C, and then through C, you can answer A, B, and D, right?
Yes.
Does that make sense?
Yes.
So again, all these are correct, but what's the priority? Let's get them started with counseling.
Yes.
And let's see if we can figure out the other 3 through counseling. Okay, does that make sense? So that's a really good example of a question that if you didn't pick up the word prioritized, you'd probably get frustrated and sit there and reread and reread and reread all these answers. Well, we should be doing that. Yeah, that looks right. Yeah, that looks right. So does that make sense?
Yes.
That's my little
Yes.
teaching. That's my little teaching, my test taking strategy. If everything looks right, or maybe 3 look right, or even 2 look right, and you are stuck between what to pick and you only can pick one answer, please go back and reread the question. You likely missed a cue, a term, or a phrase. Okay, number 4, go.
Which nursing interventions reflects secondary prevention for mental health? Screening for depression and anxiety at each encounter, teaching stress reduction techniques to young children, observing for side effects from antidepressant medication, arranging a support group for veterans with PTSD. Screening for depression and anxiety at each encounter.
And why is that secondary?
Because it's screening, secondary is screening.
Screening, you're trying to early identify, right? Early identify clients for depression and anxiety. What is B? Meaning primary, secondary, tertiary.
Primary.
Why is it primary?
Because you're teaching them to reduce to reduce the stress to young children before it happens.
Correct. Everybody understand why that's primary?
Yes.
Doing
Yes.
something as a prevention before it happens. So you can get to these younger kids and teach them coping and stress reduction. You know, that's a good thing. What is C? What level is C?
Tertiary,
Why?
because they on the medication already for the mental health, for the mental illness.
So they already have a diagnosis, or they must already
Yes.
have a diagnosis because they're on medication.
Yeah,
Pardon me. And what's D?
tertiary,
Why?
because they already diagnosed with the PTSD.
Excellent. Does everybody understand that?
Yes.
Yes.
Seriously, if you don't understand that, get with me, because we need to have, you have to have a good understanding of primary, secondary, and tertiary for all these different groups. Okay? Okay, question 5. Somebody tackle question 5.
Which nursing assessment in clients abusing oxycodone, drowsiness, confusion, apnea, and itching? I would say confusion.
Okay. What is the most important word in the question?
Important.
Nope, before
Most.
that.
Most important.
Most. Okay, what is the most important? What is amphetamine abuse? What does it cause? Think your ABCs.
Respiratory depression.
Respiratory depression. So what would that be? Right, in your answer, it'd be your apnea, right?
Miss apnea.
So here, this question, you have to think about safety first. If you know that respiratory depression is one of the symptoms of somebody that's abusing oxycodone, then apnea is asking what is the most important. So ABCs would tell you that apnea would be part of your nursing assessment. Drowsiness, confusion, itching, yes, that may all go along with abusing oxycodone. But what is it asking you? What's the most important? Okay, do you guys get that?
Yes.
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 So be careful in reading your questions. Okay, think ADPI, think ABCs, think safety. Okay, go ahead, number 6.
Which reflects territory prevention and substance abuse?
Okay, so we're looking for something that has to do with tertiary prevention. So what should jump out at you is they should already have something, right? That's what you're
Yeah.
looking for. Go ahead. What are the answers? Or what, if you could read the answers, that'd be great. Sorry.
Okay, so A is screening for patterns that indicate dysfunction in daily life. So that's not the answer because it's screening. B is providing children with information regarding substance abuse. Providing children with information. That might be primary. And then C is arranging addict-led support groups to promote recovery. And D is helping parents role model adaptive coping mechanisms. So it's either C or D.
C.
Okay.
I think it's C.
See,
I think C.
Why do we think it's
C.
I'm
C?
gonna see.
Because they
'Cause they're-
doing something.
They already addicts and they just
They're going in
Right.
recovery, so they're promoting it.
treatment at this point.
Exactly. Good job. Good job, guys. Very proud of you. Awesome. All right, question 7.
Which nursing intervention reflects non-maleficence? Obtaining a new urinary catheter kit after contaminating the sterile field. Inserting a feeding tube to administer meds in a client who swallows normally. failing to document observed side effects to administer medications, or maintaining confidentiality to a fellow nurse who is working under the influence. I think the answer is A, obtaining a new urinary catheter kit after contaminating the sterile field.
Yep, we just talked about that. That is the do no harm,
Yeah.
right?
Mhm.
That non-malfeasance is do no harm. Beneficence is do good. Okay. Look at D. Maintaining confidentiality of a fellow nurse who is working under the influence.
Mm-mm.
That is beneficence. That is the ethical principle of beneficence. Do
Mhm.
good. What is your responsibility as a nurse under the
Take care of
ethical
the patient.
principle of beneficence?
To
To
take
do
care of
good.
the patient.
Right.
To report the nurse,
Yeah.
Yes.
right?
You have to
Mhm.
report the nurse.
Report the nurse. That's the principle of beneficence. Do good. Okay. Same with C. Failing to document observed side effects. Okay. That's doing good. That's not doing good. That's the principle of beneficence. Do good. By failing to document observed side effects of a medication, you're not applying your beneficence principle. Okay. And there's really nothing wrong. Or excuse me, what's wrong with B?
They
See,
swallow
why
it normally, so
Why
why
would you?
would you need a feeding tube?
Why do they need a feeding tube?
They
They
don't.
don't.
Exactly. So again, doing good. Okay. Question 8.
The hospice nurse knows the client's pain is poorly controlled, despite a fentanyl patch and as needed sublingual morphine. Which intervention is appropriate? Add non-pharmacologic pain management to avoid the risk of addiction. Notify healthcare provider of the need for additional pain management. Counsel the client and family that a pain-free death should not be expected. Remove the fentanyl patch early and apply a fresh one in the same location. I put B, notify healthcare provider of the need for additional pain management.
Okay.
I agree.
Why is A wrong?
Because
Because
they're
they're
in
on
pain.
hospice, so like
Yeah.
you're not really thinking about the addiction aspect of it.
Does everybody understand that?
Yes.
Because pain control is one of the primary goals of hospice care.
Yes.
Comfort, pain control. We don't care about addiction at this point. Okay. Why is C wrong?
Because a pain-free death can happen. It's you don't have to, the patient doesn't have to go through pain.
Perfect. So everybody understand that. That's really important. Because what we want to communicate as a hospice nurse is that that's our goal, is to have your loved one be not suffering, out of pain. Right?
Yes.
So we can't communicate that. That's not realistic. Right? Because that's not what our goal is. Our goal is to have them pain-free. Why is D wrong?
Not gonna do any good putting a new one on if she's not doing well with the one she already has.
Okay.
And not to put it in the same spot either.
Bingo. Bingo. 2 right answers. Great. Great job, you guys. Okay, question 9. This one generates discussion, so go ahead.
The client tells
Go ahead.
the client tells the hospice nurse that I do not understand why God is punishing me. Which response is appropriate? Let me pray with you for forgiveness. Do you have a pastor I can call for you? Dying is just a normal part of life, not punishment. What makes you think you are being punished? I chose D. What makes you think you are being punished?
I agree.
say too.
Anybody have
Because
another answer?
I don't think that it's D. I think that it's A.
But no, I don't think it's A because they just said God is punishing me. I mean, I wouldn't be like, let me pray with you for forgiveness because
But
I
I
don't know what
think
you
because
trying.
they in
No, I
hospice,
wouldn't
that
do that.
would like praying for them for forgiveness. That I feel like since they're a hospice patient and they're like actively dying, then I feel like that would help them with their transition. Like praying with them if they feel like God is punishing, because I feel like you saying what makes you think you are being punished, like I don't feel like that's an appropriate response with the hospice patient just
but
because it's in
that
hospice.
I don't think that's right. Yeah, I don't think because even if you pray, y'all might have a different way of praying. So you might say the wrong thing and totally throw them off. So I wouldn't say do that either. We could call the chapels, the people come up there and talk to them and help them get through. I wouldn't pray with
It's a
them.
hard one. I don't know.
That
I
is a
ain't
hard
praying
one.
with
Who
nobody
just
'cause
said,
nah,
who
that ain't
just,
me.
who was just
But she
talking? Who was that?
also said she didn't
For what?
understand why. Understand it. What are you gonna pray for? Forgiveness for if she doesn't understand it, if she doesn't know why why
Exactly.
he would be punishing her. So you want to ask an open-ended question to figure out where it's coming from.
yes.
Yeah.
I would think that A would be a little bit insulting. I mean, forgiveness from what?
I was gonna say, even that you're kind of insinuating that they did something wrong
Right.
Right.
So
without
I don't
knowing
think it's
if that's really
therapeutic
why.
communication to say, let me pray with you for your forgiveness. It's not therapeutic. They'll probably, after you say that to them, they'll probably shut down
exactly.
and not want to talk to you anymore because
Right.
now it seems like you're putting blame on them for something.
Yep.
You ain't gonna answer. You have pastor.
Pardon me?
What pastor? Chapel was provided. You don't do that because if they had a pastor, they would call them. They don't need you at this point. So
Exactly. So the best response is, do you have a pastor that I can call for you? Because their question is, I just don't understand. Are you in a position as the nurse to help them understand with the limited knowledge you have about why God is punishing? No. No.
I would have got that wrong.
Would you guys agree that B is the right answer?
Yeah.
After talking through it, I mean,
Yeah.
if you say
I
to them,
still
what
like.
makes
I still feel
I
like
still
it
probably would have
should
chose
be.
D.
I still would have chose D because
Me too.
you're the whole point is for you to ask them why they feel that way. Like as a nurse, you want to be therapeutic with, you want to know more
That's why I
about
thought
why
that was
they
a more
feel the way
therapeutic
they do.
response.
And you may not
Would have had to throw that
know either
question
how
out at
they
this point.
if they need a pastor or if they don't even pastor involved. That may be insulting to them as well because that may not be how they.
And then what if they don't believe in God? You're asking
Amen.
them, do you have a
Right.
pastor
I
that I
think
can
this whole
call?
situation, I feel like it's like the wording of the question. It's because of the hospice. Like if it was a regular patient that wasn't on hospice, I feel like the answer would be D.
Yeah.
But I think it's because of the wording of the question that it would be B.
One of the comments that came up in another class this week about D is, what makes you think you're being punished? One of the students said, well, then you're asking them to start talking about something that might be negative about what they're being punished for. And that may start to give them a sense of guilt or a sense of shame. And so maybe you don't want to
still be able to direct you then where you could go next instead of just jumping into having a pastor be called.
I mean, they can say no, but what you're trying to do is trying to give them a resource that might be able to more competently explain the spiritual side of why God is punishing me.
And that would be cool if that would be understandable if you know that that religious part is that they do have that.
Right.
But what if this person, even though they're on hospice,
Okay.
they may not believe in that.
So you're right, but you don't know that. You're overthinking it now because you're trying to pull in information into this question that doesn't exist.
But when you put the word pastor in there, that's already making the assumption for you.
Right. You are assuming that I have a pastor, or I have somebody that I want to talk to, or you're going to supply me with somebody I don't necessarily need, or necessarily I don't believe in pastors. So you're telling me, well, let me contact your pastor. So you're pretty much forcing a pastor.
That's
I feel
not
like
what
you're forcing the pastor on them.
It's asking a question. Do you have a pastor I can call for you? The simple answer can be no. Right? It's a yes or no question.
But how are we getting to the point of answering, like, are you punishing me if you're calling the pastor?
Right.
Okay. No, this is a good discussion. This question always brings up good discussions.
It's just that would be a very difficult question to answer on an exam.
Yeah, it would be a very difficult question. I agree.
Okay.
I still would ask D.
Me too.
You still would go with D. Okay.
I still say D.
I mean, because to me, you're not getting to why are they being punished. You're redirecting them to someone else. When I thought that the patient had asked you, you know what I'm saying?
And you're supposed to be asking open-ended questions. B is not an open-ended question. That's a yes or no answer.
Which means you're not getting that more information that you may require from them. So
But this question, when you really look at it, they already said, God, why is God punishing me? So that's like giving you an idea of, oh, maybe they do have a pastor. Like, I don't know. But because a person that don't believe in God is not gonna say, why is God punishing? I don't know.
You'd be surprised
That's true.
when they're in the shoes that they're in and they're dying. They may not have believed in, but they might have.
Okay.
Well,
you know I'm saying, like, it's just. I think it could go either way.
Yeah, me too. But I feel like that's more of a
Bobby Joe, you took what I was thinking.
Great
and you did
discussion.
too.
No, you guys.
Because there's a lot. I mean, you'd be surprised with the people that you get involved with, especially people who are in like rural areas or who don't have the access to church and that.
because I remember Miss Marvel saying during the beginning of the one of the classes, she was saying that a lot of people go to, once they're in the life, they go to God, or they
exactly.
Yeah, like that's more reason to ask them, do you want me to call a pastor? Because we are, as nurses, are not equipped to answer questions that a pastor can answer. So I feel like that's even more of a reason to say, do you have a pastor I can call? Because maybe they don't, and maybe they want to talk to a pastor. That I feel like that's like kind of opening up the door for, well, no, I don't, but can you call a pastor, or like, can you get me in contact with a pastor that I can talk to? Because we as nurses can't answer questions that pastors can answer. So I don't know.
Okay. You guys, that's great. That's great. But
I
think
wouldn't
about
like
it.
that
Well,
because if somebody
you know,
say,
put yourself at the bedside now. Put yourself at the bedside of this patient, and you're the hospice nurse. There's no right or wrong answer. This is no, but I understand this is not an exam question. Don't worry about it. But
thank God.
but put yourself in this situation. I mean, these are ethical.
Oh, put ourselves in this situation. Oh, I know I call on. I always gonna call on Jesus. That's what I believe in, and I'm not trying to throw it on nobody else, but that's what I believe in. So that's it. So my answer is D, and Miss Anisha answer is D as well.
All right. We all agree to disagree.
Exactly.
Right.
Okay. Well, it certainly ponders you for thinking, doesn't it?
Yes.
Yes.
You're saying the actual answer is
The actual answer for purposes of this quiz is B.
Okay, that's what I was saying, for the purpose of
So
this.
for all of
test.
you,
Okay,
for
look,
all of
it's
you
what
that
now?
still want to do D, you're gonna get it wrong.
B as in boy.
B as in boy.
B
Thank
as
you,
in
Shantae.
boy.
Okay.
And for all of you that still believe D is the answer, if you put D in here for today, it's gonna be wrong. But I do respect the discussion. That's the most
Yeah.
important thing. Is these are real life dilemmas,
Yeah.
right? So that's, I mean, it's a great discussion, but you may be in this situation any given day, and it ponders a lot of thought. Question number 10, who wants to get us over the finish line here?
A client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy? A, would you like my help in sharing this decision with your family? B, let me see if the physician can talk to you about the benefits of radiation. C, do you think this is the best decision to make regard to your family? Or D, I've heard this new chemotherapy treatments. D, I heard the new chemotherapy treatments are not as awful.
So why is, let me just throw this out there, autonomy. If a client is willing, able, and capable of being part of their health plan, that's one of the ethical principles, the principle of autonomy. Okay, the principle of autonomy covers or says that the client must be part of the planning process, must be part of the decision-making process. We want to give them the autonomy of making that decision. So now, what should be the right answer?
A.
A.
Okay, why is B wrong?
Because
Because it's like talking
not
them out of the decision, and you're not respecting it.
Right, they've already said they're done. What about why is C wrong?
it's still talking them out of it. Like you just going to their family, like their family is making the decision for them.
You're questioning their decision. And then it's pretty obvious why C is wrong, right?
Yes.
They don't want chemo. Right? So there's all your answers. So make sure you hit submit.
Check this out though, Ms. Marble.
What was the
What?
last one?
Number 5 is wrong.
What do you mean number 5 is wrong?
Nuh-uh, I didn't. Number 5 is not wrong for me.
No, it's not wrong for me either.
What's 5?
Apnea.
What was the last one?
It's,
I pushed the wrong thing then.
number 10 is A.
All right, send me an email and I'll correct it.
Okay.
I
Do
really
we,
like.
wait, do we understand why C is the correct answer with number 5? That was the oxycodone
Yeah.
abuse, right?
Yeah,
That was a
That's
safety
ABCs, isn't
question.
it?
It's the
That was-
ABC, so yeah.
That was a safety question.
Yeah. respiratory
Everything's
distress.
everything's a symptom, but what's the question asks, what's the
Wait,
priority symptom?
Wait, for number 5, I got that one wrong too.
The
What'd you
answer
put?
was apnea.
I thought we
And which
said it
one?
was confusion.
No, apnea.
No.
We're on the
Said it
ABCs.
She said it
It's a
was
safety thing.
Yeah.
Airway,
Same
breathing,
way for it.
circulation.
Well, remember Shantoria, if you look at the question, it asks what was the most concerning. We know that respiratory depression is one of the symptoms, right? And so it would be apnea. Who else had got anything wrong that you weren't supposed to? Good discussion. Good discussion.
I really like these discussions because they really like help me, even with my critical thinking.
Exactly.
They
Exactly.
help a lot.
Yeah, I'd do this for the whole hour and a half if we could, but I do have to spend some time lecturing on content. I try and do it not quickly or blow through it, but try and give you a kind of an overview, because that should be supplemented with your preparation and your readings. But I'd much prefer to just do interactive talks like this, April said, and talk about scenarios, judgment, clinical judgment. You know, those questions are all about clinical judgment in your quiz. You know, it's fine if you memorize all the information and you get out of school and you go to practice, but then do you know what to do? You can have
Exactly.
all the knowledge in the world, but if you don't have the clinical judgment skills, it's gonna make it pretty tough. And that's why your case studies. Anytime you have the opportunity, guys, to do practice case studies, and look at real life scenarios, that's what's going to help. That's what's going to take you to the next level. Taking all this knowledge and putting it into practice. And that's just 40 years for me. What is it, May yet? No, it's only February. In May, I'm going to be a nurse for 40 years.
Wow.
I know I'm dating myself, but so, I mean, you know, I'm just trying to give back all the knowledge and experience and bumps along the way to you guys. You guys are the new era of nurses. And I can tell you that there's a lot of concern about clinical judgment when nurses come out of nursing school, right? That you have the knowledge, but you just don't have the practice yet. And that's what we're trying to focus on going forward with. And that's what Next Gen is. Clinical judgment. So April, does that help?
Yes.
Yeah, it's clinical judgment. So anyway, that's all I have for you guys. Really, really fun class. Thanks you guys for participating. I appreciate everybody's engagement and participation. Really, really do. Let's see, next week, don't forget, there are 3 exam reviews. If you can try and prioritize to get to one of them. I know everybody's super busy with school and work and family. There's one Monday, there's one Wednesday, there's one Friday. I sent you out the schedule at the beginning of the term with all of the exam reviews for 1, 2, 3, and HESI. So I know we're pretty, I think Dr. Ford does Monday, Professor Kershaw does Wednesday, and then I'll do next Friday. So if you can try and get to a review, that'd be great. And again, if you still want to review your exam 1 and haven't reached out to me, just send me an email. Send me an email with some dates and times next week, and we'll try and get it sorted out. And then the other thing, okay, thanks. The other thing I forgot to tell you is next week, or well, it's almost the beginning of week 6, probably Sunday, I'll turn on the homework grades. Okay, so you can see how your homework is affecting your grade. You guys all know what that's about, right?
This Sunday.
Turning on homework grades. If you're handing in your homework, it's going to go up. If you're not handing in homework, it's going to go down. The whole purpose of sending that to you is to show you how your homework. I don't usually have a lot of problems with homework. I'm kind of a homework witch, meaning I don't let you get away with not turning in stuff, or I'm going to reach out to you and make sure you turn it in, even if it's, you have to take the 10%, because the last thing, especially in this class, the last thing you want to take is a homework fail. Just not necessary in this class. Okay.
You said for this Sunday, Professor Marvel?
What?
This Sunday?
I think, yeah, because we're supposed to turn it on week 6.
Okay.
So I don't know whether if I should wait till after. No, because you guys won't be taking your exam. Yeah, I'll be turning it on this weekend. Yep, I will. So if anybody's any questions, I don't think I have any concerns in this class. I do have some concerns in some other classes, but again, like I said at the beginning of the term, this class is passable. Just keep up. It's passable. You have to pass it, actually. So you know where to find me. Reach out if you need me. Bobby's already reached out to me about clinical conflicts. Who else? Anisha, clinical conflicts. And who was my third? Who's my third clinical conflict? Bobby and Anisha, stay on for a minute. Shantoria, stay on for a minute. You 3 stay on for a minute. I want to ask you some questions. Okay, I'm done. You guys have a good weekend. Oh, here's a message in the chat for the Alpha group. Anybody in the Alpha group see this?
Have a good weekend.
All right, have a good weekend.